Welcome to The Explainer. Today, we're talking about a type of cancer that often flies completely under the radar, at least at first, oral and throat cancer. We're going to walk through the entire journey, from how it starts to how doctors catch it, and what that road to recovery is really all about. All right, so here's our game plan. We'll start with its silent beginnings, then cover why awareness is so important. After that, we'll look at the path to diagnosis, the treatment playbook, and wrap up with life beyond cancer. Let's get into it. Okay, Section 1, the silent start. So what exactly are we talking about when we say oral and throat cancer? Let's get right down to the basics. So, in simple terms, oral and throat cancer is basically a group of tumors that pop up in the mucous membranes, the lining inside your mouth and throat. Think lips, tongue, tonsils, that whole area. And the most common kind, by far, is something called squamous cell carcinoma. All that really means is that the cancer starts in those flat, scale-like cells that line everything in there. Now, this is the really challenging part. In the early stages, it's a silent invader. There's often no pain, no clear symptoms, nothing to tell you something is wrong. It can just grow. And that right there is precisely why knowing the risks and warning signs is so important. All right, on to our next section, awareness is key. Because if this thing starts out so quietly, how on earth are you supposed to catch it? Well, it all comes down to being aware. Knowing the risks and the signs, that's our single best tool in the toolbox. Okay, so take a look at this. These are the top risk factors. And for a long time, the two big ones were always tobacco use and heavy alcohol use. No surprise there, right? They've been the primary drivers for ages. But see that third bar? That one is becoming a huge part of the story. And that game changer is HPV, the human papillomavirus. Get this, it's now linked to about 70% of cancers in what's called the oropharynx. That's the back of the throat, including your tonsils and the base of your tongue. And what's really wild is this is causing a surge in cases, especially in younger people who don't even smoke. So what does this all mean for you? It means you have to listen to your body. We're talking about things that just stick around. A sore throat that won't quit, a lump in your neck or mouth, pain when you swallow, a voice that suddenly sounds different. The key piece of advice here is the 2-week rule. If any of these changes hang around for more than 2 weeks, you need to get it checked out. Period. Okay, let's move on. Imagine you did notice something, and you made that appointment. What's next? This section is all about the path to diagnosis, basically breaking down the whole medical process. It's actually a pretty straightforward 3-step journey. First up is a physical exam. A specialist will take a really close look inside your mouth and throat, sometimes using a tiny scope. If they see anything that looks a bit off, we move to step 2, the biopsy. That just means they take a tiny piece of tissue from that spot to check it under a microscope. And if that comes back as cancer, then comes step 3, imaging and staging. This is where you get things like CT scans or MRIs to see exactly how big the tumor is and if it's gone anywhere else. All right, next section, the treatment playbook. So once there's a diagnosis and everyone knows the stage of the cancer, it's not just one doctor making a call. A whole team gets together to create a personalized fight plan just for you. The plan usually revolves around 3 main strategies, or pillars, as you see here. You've got surgery, which is pretty self-explanatory. They physically go in and take the tumor out. Then there's radiation therapy, which blasts the cancer cells with high-energy rays. And finally, chemotherapy, which uses powerful drugs to kill cancer cells throughout the body. And very often, it's not just one of these. Doctors will use them in combination to hit the cancer from every possible angle. And this is so important. The quote here says, "Treatment focuses on ways to remove the tumor so you can speak and swallow as normally as possible." I mean, think about it. The #1 goal is obviously to get rid of the cancer, for sure. But right behind that is preserving these absolutely crucial functions. The medical team is always thinking, how can we do this while protecting the patient's ability to talk and eat? It's a huge part of the puzzle. Okay, this is really interesting. It turns out that what caused the cancer can make a massive difference in how well treatment works. Cancers that are HPV positive, well, they just respond better to radiation and chemotherapy. The flip side is that cancers linked to heavy tobacco and alcohol use can be tougher to treat. So weirdly, having an HPV-positive cancer generally means a better prognosis and a higher survival rate. It's a huge distinction. So what happens after the treatments are done? Crossing that finish line is a huge milestone, but the journey isn't over. Let's talk about what comes next. Life beyond cancer.
This next phase, aftercare and rehabilitation, is just as important as the treatment itself. It's all about getting back to a new normal. This can mean working with a therapist to improve speech or swallowing, getting help from a nutritionist, and of course, going to all those follow-up appointments to make sure everything stays clear. And maybe most importantly, it means making those big lifestyle changes, like quitting tobacco and alcohol for good, to give yourself the best shot at staying healthy. So, we'll leave you with this to think about. Knowing everything we've just talked about, the risks, the signs, how important it is to catch things early, what's one thing, just one small change, you can make for your health starting right now?